Sorry, Minister. Do you mind just answering the question? You've been asked multiple times now. I get it. It's about access. That's fair. But the question is, is a pharmacist billing less than a doctor? And are Ontario taxpayers saving money as a result of those million visits? Please don't shut us down.
Hey everybody, welcome back to the channel. And boy, do we have a good one for you today, as we're about to witness some chaos develop between the media and this lady, Sylvia Jones, as she continuously refuses to answer a very simple, straightforward question that she has the answer to. Now, if you're unfamiliar with who Sylvia Jones is, I view her as kind of the Chrystia Freeland of Doug Ford's party. She's Ontario's Deputy Premier, as well as Ontario's Health Minister for Doug Ford's Progressive Conservative Party. Now, before we get into all the clips of this back and forth between the media and Sylvia, this press conference was addressing how they want to open up the scope of practice for pharmacists in terms of ailments that they can treat as well as prescribe medications for. Now, back in January of 2023, they allowed pharmacists to treat, I think it was 19 different ailments like canker sores, herpes, hemorrhoids, pink eye, dermatitis, stuff like that. But now they want to add 14 new ones, like their ability to give shots for tetanus or hepatitis, shingles, as you're going to see here.
Well, the province is looking to expand pharmacists' abilities to prescribe and treat patients even further. The Ontario government is consulting on allowing pharmacists to diagnose and treat more common ailments, administering more vaccines, and performing more point-of-care testing. And that can include sore throats, ordering strep throat testing, threatening or treating mild headaches or minor sleep disorders, and administering vaccines at pharmacies such as tetanus, HPV, hepatitis, and shingles.
Now, in all honesty, I don't have a problem with them opening up the pharmacist's scope of practice to deal with these ailments, because they definitely educated enough to handle these. I myself am a registered massage therapist for over 10 years now, and I remember when I was taking my course, it mirrored a lot of the nursing programs. We had the same anatomy courses, same physiology courses. I had to take neuroanatomy, and I even did some pharmacology, because if a patient was on a certain medication, we needed to know how it would affect our treatments. Like if they were on blood thinners or even just general Tylenol, that could really affect their perception of pain and pressure, which could affect the treatment. Now, as a registered massage therapist, your scope of practice is definitely a lot smaller than, say, a chiropractor and what you can do. And even if 9 out of 10 times I knew you were developing a frozen shoulder, or you had frozen shoulder, or you were developing scoliosis, something like that, we're technically not allowed to diagnose you. We can just refer you to a doctor. But as I said, the pharmacists definitely have the educational background to deal with these ailments that they've listed. However, that's not the problem at hand. The problem at hand is that Sylvia Jones would not answer the media's question on how much this is going to cost us Canadians, whether it's going to be more than just going to see the doctor, or if it's going to be about the same.
Hi, Minister. Rob Ferguson from The Star. Just wondering, what kind of fees are you contemplating? Would they be similar to the fees that pharmacists are already getting? And could you outline what they are and how they compare to what a doctor would get for a similar visit?
So the work that we are doing right now is on the consultation of the actual items that we are considering expanding scope of practice. It does not include discussion or conversation about fees.
Okay, could you just answer the one, what are the fees now? Like, is it a set fee for every consultation?
We will not cover fees today. Thank you.
But I'm asking what the fees are you're already paying. Surely you know that. You're the health minister.
We will not be covering fees today. This is a consultation on the expansion.
I get that, but what I'm asking is, what are the fees you already pay?
We're not covering fees today, Rob.
Okay. How many applications have you got yet for well, I was trying to get an answer to my first question, which she's not answering. Yeah. So
Are you having a debate amongst yourselves?
No.
or are you having-
It'd be nice if you would answer a simple question. It'd be nice if you would answer a simple question. But anyway,
Yeah, it would be nice, especially such a softball question like the one that he gave her. I don't understand why she's so adamant about not explaining how much the cost is. But this isn't the only type of questions she refuses to answer, because his follow-up question is about how many individuals have actually signed up for this or put some support behind it. And she says, oh, well, the portal is still open, so I can't give you a concrete answer, which I think just even a ballpark number would be nice. But we saw this when Mark Holland wouldn't even answer about how many dentists have signed up for their new program. So I'm not really surprised when it comes to these ministers of health not answering these questions. But as we move on to two other reporters, the next reporter is asking her about Ontario Place and the Science Center, because not only, as I mentioned, is she the Minister of Health, she's also Ontario's Deputy Premier. So she kind of works hand in hand with Doug Ford, and his whole thing is about getting Ontario Place running, shutting down the Science Center, and bringing it over there. And they're talking about the infrastructure, how much all the cost is. And something that's really, really irritating is the lady who's facilitating the question period just keeps cutting off the reporters and tries to shut it down and say, next question, to not get her to answer.
Thank you. Next question.
Hey, Minister John Woodward from CTV News. This is in your capacity as Deputy Premier. We've just been hearing a lot of mixed messages about this parkade at Ontario Place. And I'm wondering if you know whether it's going to be overground or underground, what the timeline is and what it's going to cost.
I'm sorry, I can't help you with that.
Next question.
Next question. Okay, well, I'll ask you about the Science Center, too, because as you've seen, there's been another critique, a second critique about the second engineering report. And I wondered, part of that critique levels the accusation that the government applied a factor to increase the cost beyond what's reasonable. They say it should be around 200 million rather than the $500 million assessment. What do you make of those numbers? And was this the number that we're getting from the government too high?
You know, when engineering reports come back to the government, to Infrastructure Ontario, that suggest that the facility is in danger and that we would be putting individuals who are working and visiting in danger, I think it is incumbent on us to act and act quickly, and that's what we did with the announcement that came through Infrastructure Ontario and our government. We need to make sure that young people who are accessing these services, whether it is at the Science Centre or other facilities across Ontario, are properly protected. And it would not be appropriate for us to ignore some very clear engineering advice that suggested structurally the building was unsound.
Next question, please.
Even
Next
though the
question.
building did quite well on the
Next
rains last week.
question. Next question.
Yeah, and that's a solid point that guy just made, because if we think about what happened last week in terms of the flooding and the heavy rain, the DVP, that infrastructure failed, tons of flooding downtown, the TTC, Union Station, all of these areas in Toronto with the infrastructure is so good, failed horribly. Yet the one where the Science Center, they're talking about the roof is cracked and it might collapse, held up perfectly fine with all that rain. So kind of interesting that she can't answer this. But as you heard, the facilitator continues to say, okay, next question. And that reporter decides to ask her again about the pricing. And listen to this word salad that she gives them.
Thank you, Minister. And as regards today's announcement, I understand you're still consulting. You can't talk about.
We're just starting the consultation.
Got it. But since the pharmacists already you have expanded their role already, can you give Ontario taxpayers an idea about if this is going to cost them more as opposed to doctors continuing to do all of these assessments and prescriptions? Is this going to be an extra cost to Ontarians?
You know, for me, this is about access. So as Justin Bates articulated, you know, we've had over 1 million assessments since we made the initial scope of practice changes. We are doing scope of practice changes consultation and discussions with many of our regulatory colleges. You have seen some changes most recently with midwives, with registered nurses, with nurse practitioners. We want to make sure that all of our healthcare practitioners are operating within their scope of practice to ensure that the patients and the public have access and options. I think it's really important to focus on how does this improve that patient experience. And if I, as a patient, can go into my local pharmacy instead of having to take time off work, instead of having to go to an emergency department, instead of having to see my general practitioner, that to me is an improved access and outcome that we all need to strive for.
This woman really does deserve to be in politics because just like Mark Holland, Chrystia Freeland, Jagmeet Singh, even Doug Ford, she just won't answer a simple question. She starts off by saying, well, to me, this means access. We don't care about what it means to you. It's a very simple question. What does this mean to Canadians? Is it going to cost us more? And you're going to hear from the next reporter who essentially says, well, with that crap answer that you just gave us, are you telling us that it's going to cost more? And she kind of pushes back. And this is where the opening clip starts to take place, where all of the reporters are just kind of fed up and being like, listen, we're just looking to get a regular answer from you.
Hi, Tina as Danny with City News. So can we take from that answer that it will cost more to pay pharmacists to do these things than family doctors?
No, not at all. What you can take from that answer is that we are ensuring access. It's not an either or. It's not an option. It's an option to patients to ensure that they have a choice. They have a choice to go and have a conversation with their primary care practitioner. They have a choice to visit their local pharmacy and get the treatment they need. And 1 million visits in just over a year and a half suggests to me that the people of Ontario are absolutely embracing and accessing this option.
Shouldn't that also suggest to you, though, that there's a lack of family doctors? And we've recently heard new data that 2.5 million Ontarians are without a family doctor. Are you using pharmacists as a replacement here?
You know, we've also, as you know, made expansions and investments to ensure that people who want have access to a primary care practitioner. In February, 78 new or expanded primary care multidisciplinary teams were announced. This is a government and a ministry that is working on all parts of the system to ensure that we have sufficient capacity, that we are training sufficient numbers of healthcare practitioners.
Did you notice that she didn't say no? She's not trying to replace doctors with pharmacists. She just went on to talk about how we need to train more people and how many people signed up and how many new individuals there were. But the question was pretty straightforward. Are you using pharmacists to replace doctors? Because there are so many people without doctors, but everybody has a Shoppers Drug Mart and they can access a pharmacy. And again, just dodges the question, which I'm sure the reporter picked up on because, again, she now goes back to questioning about why are we not getting the cost breakdown? Why are we not talking about it? And the facilitator, again, tries to shut it down, says next question, and then this is when that gentleman comes back and says, no, listen, we want an answer. Stop dodging us.
Minister, why aren't we covering fees today? Why isn't that something you want to disclose to the public?
Sorry, Minister. Do you mind just answering the question? You've been asked multiple times now. I get it. It's about access. That's fair. But the question is, is a pharmacist billing less than a doctor? And are Ontario taxpayers saving money as a result of those million visits? Please don't shut us down.
I'm not shutting you down. What I'm saying is the consultation that we are announcing today has nothing to do with the fee component. We are talking to the public and the OMA, the Ontario Pharmacy Associations, to make sure that the proposal of 14 new expanded scope of practice are the appropriate ones for us to move forward on. It is a separate and distinct difference between any conversations about compensation.
Now, even if that was the case and your goal was just to talk about the scope of practice and the consultations, you still have that information, and the reporters asked you a very softball question. Is it going to cost Ontarians more, less, or roughly the same? And you have the answer, but you won't give it. However, later on, one of the reporters that was there, who works for City News, reported on their own platform that, yeah, it's going to cost roughly the same as to go see the pharmacist as it is to go see the doctor.
I'm not shutting you down. What I'm saying is the consultation that we are announcing today has nothing to do with the fee component.
It speaks to the absolute lack of accountability that we've seen with this government, who is ultimately benefiting. And I have a feeling that someone like Shoppers Drug Mart is actually standing to benefit a lot more from today's announcement than the patients of Ontario.
A total of 14 ailments have been added to the growing list of conditions pharmacists can treat, and includes sore throats, calluses and corns, headaches, shingles, and sleep disorders. The Ontario Pharmacists Association has since confirmed it will cost the government roughly $19 per visit, similar to what it would cost a family doctor.
What I see from the announcement today is simply a band-aid solution.
And I have to agree with Adil there. I believe that's how you pronounce his name, the health critic, that this is definitely a band-aid solution. And he makes a solid point about how shoppers seems like they're the ones who's going to be benefiting from this the most. Not only are now the pharmacists going to be able to diagnose for all of these ailments, they also get to write the prescriptions, which, guess what? You got to go to Shoppers to get your prescription anyways. So now it's becoming a one-stop shop where Shoppers is going to benefit from virtually all of it. And who knows if there's going to be any sort of a kickback situation happening, or if we're going to see a huge increase in prescriptions for certain medications now that they get to do that. Not to say that all the pharmacists would be shady or act in shady ways, but there's definitely going to be people taking advantage of this situation. But as always, this is just my opinion. I'd love to hear from you guys, so please let me know what you think about all this in the comment section below. And as always, I will catch you guys on the next one. Thanks so much.